Mastoiditis. Mastoiditis is a bacterial infection of the mastoid air cells surrounding the inner and middle ear. The mastoid bone, which is full of these air cells, is part of the temporal bone of the skull. The mastoid air cells are thought to rotate the delicate structures of the ear, regulate ear pressures, and possibly rotate the temporal bone during trauma. When the mastoid cells become infected or inflamed, often as a result of an unresolved middle ear infection, otitis media, mastoiditis can develop. Because so many vital structures pass through the mastoid, infection may rest outside of the mastoid bone and cause serious health complications. Acute mastoiditis typically affects children, but adults can also be affected. Some people have chronic mastoiditis, an ongoing infection of the middle ear and mastoid that causes persistent redness from the ear. Mastoiditis symptoms may include fever, irritability, and lethargy, swelling of the ear lobe, redness and tenderness behind the ear, redness from the ear, bulging and drooping of the ear. Mastoiditis complications may include 1. Facial paralysis, 2. labyrinthitis, 3. Hearing loss, 4. red abscess or meningitis, 5. Vision changes or headaches, blood loss in the brain. Mastoiditis diagnosis. The doctor will first look for infection inside the ear with an instrument called an otoscope. Mastoiditis is uncommon without a coinciding ear infections. A sample of the infected ear fluids should be collected for culture. If complicated, severe, or chronic mastoiditis is suspected, you will be referred for a CT scan to image the mastoid area. If a pocket of fluid or pus is found anywhere in your ear, neck, mastoid, spine, it will need to be drained and then cultured, so antibiotics can be tailored to the bug found. Mastoiditis treatments. Antibiotic therapy is the mainstay of treatment for both acute and chronic mastoiditis. With acute mastoiditis, antibiotics will be given through an IV intravenous line to treat the infection. Surgery may also be needed to drain the fluid from the middle ear, called a myringotomy. During a myringotomy, the doctor makes a small hole in the eardrum to drain the fluids and relieve pressure from the middle ear. A small tube may be inserted into the middle ear to keep the hole from closing shut or to allow for continued redness. Typically, the tube will fall out on its own after 6 to 12 months. If the symptoms don't quickly improve on IV antibiotics or complications, surgery to remove the infected mastoid bone may be recommended. This is called a mastoidectomy. With chronic mastoiditis is treated with oral antibiotics, ear drops, and regular ear cleanings by a doctor. If the treatments do not work, surgery may be necessary to prevent further complications. Prevention. If you have an earache, discharge, or trouble hearing, see your doctor. They will decide if you need antibiotics to help prevent mastoiditis and other serious health complications. Thank you very much.